All right. How's my audio? Can people in the back hear me okay? All right, fantastic. Well, thank you all for coming to my talk today, and I'm just going to go ahead and jump in so that we have as much time to make this as interactive as possible. It does look like there's some people with computers and phones, so I'm going to try to be using some poll everywhere, so be ready for those as they come. All right, I'm sure that most of you are familiar with the concept of market segmentation, and that's the process of identifying target customer groups and developing the best possible offerings to market to these groups. And I think in today's day and age, we're even more acutely aware of this because of the rise of social media marketing. So a couple years ago, Facebook knew that I was a 20-something who was married, and my Facebook was pretty well full of fertility testing ads. And now Facebook knows that I am a mother, and so this is the kind of ad that I have all the time on Facebook. So again, this is just at the most basic level, our intuitive sense of what market segmenting is. Now, there's a number of reasons why companies, as you would imagine, do market segmentation. For the first reason, it can help to create stronger marketing messages. So instead of using generic or vague language that speaks very broadly, they can try to speak more specifically to the needs or wants of a specific target audience. So again, a non-pharmacy example. About 2 years ago, I was a DINK, so dual income, no kids. And so when I would get ads for things like HelloFresh, they would often advertise to me about hip farm-to-table ingredients and doing things like taste tours to live out your travels at home. Now, if they were to segment me, I actually haven't gotten a HelloFresh ad in a while, but if they were to segment me as a working mom, they would probably market the product as saving time or helping me to provide healthy meals for my family. And so rather than just saying, hey, we have these meal kits, they're really trying to target who I am and what's important to me and create a marketing message that speaks accordingly. And in doing so, they can help to build customer affinity. So a customer who feels like their needs are being met is going to show greater loyalty to their product. So again, if they have done focus groups with working moms and find that on average I have about 20 minutes every night with which to prepare dinner, and that 30-minute meal really isn't going to do it for my family, they can craft a product that speaks to that woman who has 20 minutes, and now all of a sudden I'm a loyal HelloFresh customer because they have met my need more so than, say, Freshly or some other boxed meal service that only creates 30-minute meals. And it can help you to identify market opportunities. So let's say that HelloFresh realizes there's a segment out there of older women who are burnt out of cooking. They've been cooking for dozens of years for their family, but they still like home-cooked meals sometimes. They can maybe target a set of boxes that comes once a week and down home, traditional home cooking for that one day a week you still want to cook when you don't go out the rest of the days. So again, trying to use a non-pharmacy example to bring us all together to see the value in market segmenting. Because we're going to spend the rest of today's talk talking about market segmentation in pharmacy. And we're going to talk about it mainly from two perspectives. First being pharmacy patronage. So that refers to what type of pharmacy somebody goes to. Do they go to a chain pharmacy, a grocery pharmacy, independent, mass merchandiser, mail order? And what types of pharmacy services do they use? So think about the services that are offered at a community pharmacy. Things like vaccination, automatic refills, medication therapy management. And so throughout today's talk, we're going to be addressing both of these. Who's going to what types of pharmacies and who is using what types of pharmacy services. So a bit of background, what do we know about market segments in pharmacy? Well, much of the literature focuses on what we call psychographic segments, and that's, again, kind of a jargony word, but really what we're talking about is segments that are based on beliefs, motivations, and priorities. Now, those of you who know my dissertation work know that it focused in this realm because I was looking at preferences for pharmacy attributes and understanding then if there's differences in who goes to what types of pharmacies based on what they prefer in a pharmacy. And my research added to an existing body of knowledge on how people who have different priorities for a pharmacy do go to different types of pharmacies. And we've also seen some preliminary research that is also related to patients' use of pharmacy services. So this is really interesting research from the kind of academic perspective. From the very practical perspective, this information is not always very accessible to pharmacies. So when I walk into the pharmacy, does that pharmacist know why I showed up there or what's most important to me just by looking at me? Probably not. But what do they know? They can assess my gender, they can assess my age, they might know something about where I live, my presumed socioeconomic status. And so this research is going to start to try to look at segments based on those most accessible characteristics of patients. And there's certainly an appetite for this, because if the pharmacy blog and news sites are any indication, people are asking these questions and want to see this type of content. So these are some headlines from various non-peer-reviewed type of journals and websites. You know, millennial shoppers, what they mean for your pharmacies, how to appeal to women in your pharmacy, rethinking healthcare for baby boomers. So unfortunately, there's a lack of published academic literature on these demographic-based segments. Much of it is published before many of our Pharm.D students were even born, or it focuses on mail order compared to brick and mortar patients. So there are a good number of studies that say, here's who's using mail order versus non-mail order, but we are really interested in kind of some more nitty-gritty of not all brick and mortar is the same. So a chain pharmacy isn't the same as an independent pharmacy. And there's very limited information on who uses what pharmacy services. So somebody will publish a study saying, we initiated an appointment-based medication synchronization program at our pharmacy, and here's who used it. But that just gives us limited information about who used this one service at this one pharmacy, and not kind of broader information from throughout the country who is using pharmacy services. So that's where this study came in. Our goal was to better understand associations between patient demographic and health characteristics and their decision-making surrounding community pharmacy. So again, there are associations between their characteristics and those two aspects that we talked about earlier, pharmacy patronage and service utilization. So I want to zoom out one more time about big picture before we dive into the methods and results and say again, why does this matter? Well, if our goal is to identify patterns, who's going to each type of pharmacy, who's using pharmacy service, from there we can generate hypotheses about how pharmacy services provide value to specific demographic use and use that to inform a more effective and targeted development and marketing of pharmacist services. That's kind of the big picture. And so the research that I'm going to talk about is very much hypothesis generating to, again, then start to work towards understanding better how we're bringing value to different patients and how we can market then our services more effectively. Many of you are quite familiar with my dissertation research at this point, so you may recognize this slide. And I wanted to take the opportunity to just pause and say this does use data from my dissertation research. And the primary analysis in my dissertation research was a discrete choice experiment about patient preferences. And alongside that discrete choice experiment, we collected a lot of demographic and health information. And so this research that I'm presenting today was not the primary outcome, if you will, of my dissertation, but which is why I just keep kind of emphasizing it as hypothesis generating. And so if you want to pick it apart as were you powered to analyze this one specific outcome, like, no. But I think it provides valuable insight that really does fill a real gap, and that it's going to, as you'll see, generate some really interesting ideas for follow-up research. So our patient population came from a Qualtrics panel. It's a panel of people from across the country who opt in to receiving and completing surveys it's a very nominal amount of money. So our survey, they ended up getting paid probably in the ballpark of 50 cents. But they're able to, our inclusion criteria, they had to be adults, they had to be able to read and understand English, and they had to have filled a prescription, any prescription, one prescription, at a community pharmacy in the last 12 months. So they can't be exclusively mail order patients, and they can't just not have any medications in the past year. And we targeted a sample size of 500. So I won't go through all of these, but I wanted to put them up as this was the list of demographic and health characteristics that we included. The demographic characteristics are pretty self-explanatory. A couple of interesting things on the health characteristics side. So we asked patients, how many prescriptions do you take on a regular basis? So that's how we assess number of chronic medications. And then we also were trying to get at how do they serve as a caregiver, and to what extent do they serve as a caregiver? So this is a variable I call number of chronic medications care recipient. What we asked them specifically, we said, approximately how many different prescription medications do those for whom you serve as the primary caregiver, for example, child, parent, or spouse, take on a regular basis? Consider only those medications for which you are primarily responsible for filling and or picking up from the pharmacy. So I highlight that one because we're going to talk about caregivers as we go on. That's how we assessed whether somebody was some type of caregiver. We asked for their current pharmacy patronage, and then we asked a question that was based on a past survey that had been published saying, thinking of the pharmacist you interact with most commonly, would you say that your pharmacist knows your name? And the response options there, yes, no, unsure, or I do not interact with the same pharmacist regularly. And then the last one I'll highlight is health confidence. We asked them, how confident are you that you can control and manage most of your health problems? And again, we didn't invent that language, that's from the literature, but that will come up throughout this discussion today as well. And then we surveyed whether or not they use any one of these 11 pharmacy services. So some were refill related, automatic refill, medication synchronization either with or without an appointment, home delivery, smartphone app, we have medication adherence packaging, we gave them these examples, blister packaging or pill box, immunizations, which we broke apart as either flu vaccine or non-flu vaccine, compounding, and MTM. All right. So we surveyed 741 people was our final sample size. Again, you'll recognize this slide. Many of you have seen it before. Our sample was primarily women, primarily white, and then this is a little breakdown of our age from the youngest participants to our oldest participants, comparing our study population with the US study population. So you'll see that our population was kind of overrepresented in the middle ages, so this 25 to 64. And then a little bit underrepresented in the very old and the youngest adults. So just keeping that in mind as you see who we got. All right, so here's our first opportunity for audience participation. So those of you who have a phone or computer out, I'm curious to see at what type of pharmacy do you most commonly fill your prescriptions? I want to see if you all are representative of the population that we received. So it should be active. Yes, somebody's responded. I'll give you a couple more seconds because we're still getting a few results coming in here. All right, let's see what we've got. All right. Well, this is actually pretty close to the sample that we got. So we've got just a slight majority of you all fill out a chain pharmacy. We had 52% of our study population. Then we've got about a quarter of you who go to grocery pharmacies. That's a little bit more than we had, and it looks like where the difference was not as many of you use like Walmart or Sam's Club. We had a bigger population amongst our survey participants who did mass merchandiser pharmacies. And then very few of you, that's probably like one person here, goes to an independent pharmacy. All right, so that's who we're working with, our survey population. So I want to do one more poll everywhere question now. And what this is, you guys are my demo on this. I've never done this before. But what I'm going to talk about now, so we just said, okay, here, well, I'll go back one slide. So we said, here's who we have. We have a distribution of patients who goes to these types of pharmacies. So then we wanted to say, well, who is going to which types of pharmacies, right? And so that's what this is getting at here. So these are the characteristics that I've included in our poll everywhere right now. So of these characteristics, which of these do you think were associated with pharmacy patronage? And if you go into Poll Everywhere, it's supposed to be an upvote situation. So you should be seeing these, and if you think something was associated with pharmacy patronage, you know, your top 1 or 2 that you think were, oh, I guess it's going to show you as they're being upvoted. Go ahead and upvote things that you think were associated. And this is in, for the technical amongst us, this is in multivariable analysis. So this is controlling for all these other things, which of these things was independently associated with pharmacy patronage. All right. This is interesting because a couple of the biggest ones are not showing up. Yeah. So somebody is answering income. I am curious. So which incomes do you think are going to which pharmacies? Somebody want to shout out what their thought process on that one was? Yes.
I feel like the chain pharmacies higher
Go to chain pharmacy. Okay. Yeah, that's a very good thought. Did you guys hear that? All right. So income was not independently associated with pharmacy patronage. But let's see. You got a couple that were, and so these were the big 3. Yes, these were the only 3 plus pharmacist who knows your name, which we're going to get to in a minute, that were independently associated. And again, like, I'm not trying to advertise anyone in particular, but we have mail order, independent pharmacy, grocery, mass merchandiser. Chain was the referent category, so it's not on here. But so what we found was that patients in rural and small town areas were significantly more likely to go to independent pharmacies, mass merchandiser, or mail order compared to chain, and then compared to their urban and suburban counterparts. We also found that this varied by region within the United States, so it was a little bit different. And then we found that the older you got, the more likely you were to use a mail order pharmacy. So talk about those just a little bit more. This finding that rural patients were more likely, particularly, to go to independent pharmacies is consistent with a vast amount of literature out there on the role of independent pharmacies in rural communities. So we know that approximately 1/4 of rural independent pharmacies are the only pharmacy in their community, and that 80% of independent pharmacies are located in areas with populations that are less than 50,000. And so already today, actually in my Kaiser Health News alert, there was an article in the Wall Street Journal about what's going to be the impact of these closing rural independent pharmacies as independent pharmacy is becoming less financially viable in a lot of places, seeing those closures, what the impact in those communities are going to be. And it's a discussion that's been happening for years, and it literally came up on my, my news alert on my phone this morning. And these pharmacies tend to maintain disproportionate market share in underserved communities. And so again, we're just seeing that, just adding to the body of knowledge that independent pharmacy really matters in rural communities. We also see that rural patients often prefer independent pharmacies. A lot of times these are locally owned and operated. They have relationships. They have great loyalty to these pharmacies because they know the pharmacist there, and that pharmacist is a member of that community. So nothing surprising with this finding, but again, it's always something that resonates with current issues and current literature is always interesting to see. So I think it speaks to both the accessibility of these pharmacies and patient preferences for them. But then in light of these pharmacies closing, is that potentially one of the reasons why we're seeing a pull towards, say, mass merchandisers? The Kaiser Health News today said a lot of groceries in rural areas are closing their pharmacies, which is further driving to mass merchandisers. So just kind of interesting within the body of literature that's out there. And then the finding of age and mail order, I think that's mostly going to boil down to your insurance incentives. So Medicare providing insurance incentives for cheaper co-pays and 90-day supplies if you go to mail order. And this was a very high odds ratio. So compared to their suburban counterparts, rural patients were about 3 times, here it was about 3 times more likely to go to an independent pharmacy. Older adults over 65 were over 13 times more likely to use mail order pharmacy. So again, thinking about if we as pharmacists are concerned about mail order patients not getting as much pharmacist interaction and having the value of that pharmacist relationship and the value of that exposure opportunity to talk to your pharmacist every month, then where do we need to look? Potentially these insurance incentives to make sure these patients aren't being made to go to mail order pharmacies when there may be value in interfacing with a pharmacist more often. So I'm going to break generally with my rule of only discussing statistically significant results to highlight a result that was not statistically significant, but I think was not what I was expecting and is nonetheless interesting. So we found that overall 11% of our population went to an independent pharmacy, and that was between 8 and 10% amongst the older, the 45 plus crowd, but it was 13.5% among the youngest, of whom, millennials I think goes up to age 38. So most of these are kind of, if we want to typecast them, millennial types. And this is despite the fact that millennials were significantly less likely to live in rural areas. So these are oftentimes suburban, urban millennials who are still going to independent pharmacies. And so I think that's interesting, again, for a couple of reasons. One, the past literature, the only other really national survey of this type was done almost 10 years ago now, and they found that the average age at independent pharmacies was significantly higher than at like grocery and mass merchandiser pharmacies, as much as like 10 years older. So they didn't see as many young people going to independent pharmacies. And so this is different, again, than what's been found, but also because there's a lot of talk about millennials and convenience. Millennials are going to be the death of retail. Millennials aren't going to brick and mortar shops. There's this Amazon pharmacy. Everybody loves their Amazon Prime. This is where millennials are going to go. And this shows that at least right now, we might not be seeing this massive exodus. Like, there's still hope. Don't count out the millennials altogether, I think would be my message on this one. And interestingly, I've seen a number, again, in kind of the pharmacy blog space of people talking about this, that millennials, we're also seeing them drawn to kind of the hyper-local experience. So if they are going to go to a store, they want it to be local, authentic. And so might we look at independent pharmacy, what is drawing millennials there? Is it the fact that it's relationship focused with a local pharmacist, locally owned? How might that inform our front end sales? Might we want to offer, not just our freezer of DiGiorno pizzas, but maybe we have a little section of fresh fruits and vegetables and cheeses from local artisans or something? If that's a reason that's drawing this younger crowd to that more local pharmacy experience, then maybe that's something that we can build off of. So this is, again, a hypothesis. I think it's an interesting research question to understand that interaction between millennials and independent pharmacies. I saw, and then the blogs will go into other things like how to draw more millennials. They recommend things like loyalty cards and Apple Pay. And I don't know, I don't have many loyalty cards and I don't have Apple Pay. I'm a millennial, but maybe we need to be telling independent pharmacies to get with the Apple Pay train. I don't know. Another interesting survey that I found, this was from Accenture, so again, not the peer-reviewed literature per se, but they found that 91% of millennials, so they asked millennials, do you prefer online shopping or brick and mortar shopping for any number of things? And drugstores was one of them. 91% prefer brick and mortar shopping for drugstores. And again, this is what I talked about in terms of favoring local businesses. So my take-home point here, again, it's not statistically significant from a research perspective, but I think it has meaning in the real world to not count out the millennials when we're thinking about the future of particularly those local independent pharmacies. All right. Moving on then to patient-pharmacist relationship. So patrons at which type of pharmacy were most likely to report that their pharmacist knew their name? got some good results. All right, yes. That was the answer. Oops. It was far and away the independent pharmacies. So overall, we had about a third of patients reported that their pharmacist knew their name. And I'm going to say this, when I talk about it, I'm going to be talking about patient-pharmacist relationships, which that's what I'm referring to. This was the question that we used to assess that, just as like kind of a proxy for having a patient-pharmacist relationship. So we find that it's about a third, and that it was lowest in mail order and highest, almost double, amongst independent pharmacies. So even after controlling for other variables, or it was even higher, when controlling for other variables, patients at independent pharmacies were 3 times more likely to have a pharmacist who knew their name. This one was a little bit surprising to me. I'm not sure how these mail order patients, in my experience, I've never even known the pharmacist who would fill a mail order prescription, but they could be like specialty mail order pharmacies that do have more patient pharmacist interactions. So let me, okay, so then moving on, so we have that the independent pharmacy was strongly associated with having a patient-pharmacist relationship. Were there any other factors that were associated with having this? And there were a few. So the biggest predictor, or one of the biggest predictors, like I said, going to an independent pharmacy of having a relationship with your pharmacist, but also chronic medication use. So again, this makes sense. If you're on a chronic medication, you're going to the pharmacy every month, you're substantially more likely to have a relationship with your pharmacist than somebody who has to fill just an occasional antibiotic or cough syrup, right? Same thing with caregiver. If you're filling not just your own, so you're very much more likely to have a relationship if you have your own medications, but also if you fill the medications for somebody else. So if you're filling your child's prescription, you're filling your mom's prescriptions, you're almost twice as likely to know that pharmacist. And then pharmacy services. We looked at all of our pharmacy services, and of them, which were associated with having a relationship with your pharmacist. And these were the only 2 that were significant: medication synchronization and adherence packaging, twice as likely. So again, think back to our list of pharmacy services and which ones, what makes sense as to why they would foster a patient-pharmacist relationship. And things like home delivery or influenza vaccines or email or text reminders. Those are not things that are physically bringing you in front of the pharmacist on a regular basis, right? But that's the difference between these 2. I think you're showing up at the pharmacy every month and your pharmacist has actually packaged your medications into a daily, in a way that's going to make it easier for you to take them. Or you're meeting with them every month to go over your medications in these appointment-based medication synchronization, though this variable actually included non-appointment-based as well. But just again, coming every month and getting some of those more complex pharmacist services where your pharmacist is really making an effort to improve your ability to take your own medications, that is fostering these pharmacist-patient relationships. One other thing, there is a lot of, to just go into detail back on this one for a moment, there is a lot of literature on independent pharmacies and patient-pharmacist relationships, and it's a little bit of a chicken or an egg, because to some extent, are patients going to an independent pharmacy because they value having that relationship, and so they want to get to know their pharmacist, they want to enroll in these services. But also, do independent pharmacies just have pharmacists who are less burnt out, who are more focused or are given more time or opportunities to speak with patients, and that's valued culturally there more often. We do see that there's lower staff turnover at independent pharmacies, so maybe that's fostering these longer-term relationships. So again, there's a lot of literature out there on, we've observed this, and there's theories, it could be that different patients go, it could be that the pharmacist's there, or it could be the environment, that they're there longer, but this is not surprising, but it's interesting to know nonetheless. Now, this is a finding that I thought was particularly interesting because patients whose pharmacists knew their name were significantly twice as likely to feel confident in their ability to manage their health, even after controlling for all their other characteristics and where they went to pharmacists, or where they go for their pharmacies. So I point this out mostly because it just adds to the literature out there that pharmacist-patient relationships matter. Okay, so we can empower patients. We know that here in pharmacy school, that we have the capability to really empower patients to be able to manage their health, and these results are just further showing that our intuitive sense that we can really help patients, that it is showing up in the real world, that pharmacists really are making that difference to patients. But I also think there's a marketing application here, because a lot of the marketing that we do around pharmacy services is that we can help you manage your meds, we can help you know your meds, but at the end of the day, is that most fundamentally what patients want? Or is it something more basic that patients want to feel confident about their ability to manage their health? And yeah, knowing their meds might get them to that point where they feel confident, but what if, like, the baseline, you know, in marketing, what do patients really want? Do they really want maybe this confidence? And how can we say not something so technical when we market our services, that, you know, we'll be able to make sure that you know all your drug interactions. You know, that's very technical. Like on the most emotional level, patients want to feel confident. They don't want to be going through life feeling like they just can't possibly manage their health. And so maybe it's just a slight tweak in our messaging that we can help promote this confidence. Might that resonate a little bit more strongly with patients than some of the more technical jargon that we often use when we talk about our value to patients? So again, take-home point, patient-pharmacist relationships matter, and expanded pharmacy services promote these relationships. Okay, moving on to another interactive. So now we're going to be talking about pharmacy services. So what do you think were the pharmacy services that were most commonly used by our survey respondents? All right, this is pretty close. This is very close, actually. So I think your intuitive sense of what people are using, or maybe what you're using at your pharmacy, very much reflects. So we've got automatic refill followed by flu vaccine and email text reminders, very close to what we found. So we saw automatic refill was the most commonly used pharmacy service, 60% of people. And then we saw followed by email or text reminders and the flu vaccine, down to, you know, very few people. Now, we didn't have a lot of older adults, so I think that's speaking to why we didn't have a lot of patients who had MTM. But yep, we've got all sorts of people. So I'm gonna kind of focus in on two of these to kind of discuss in a bit more detail. And the first is pharmacy vaccinations. So here again, we did not see anything dramatically different than we might expect. So we saw that women are significantly more likely. So women are about 2 times more likely than men to have reported receiving of pharmacy vaccinations. Older adults are significantly more likely. So 45 to 64-year-olds are about twice as likely as those younger than them to have received a vaccine, and older adults were 4 to 6 times more likely to have received a vaccine at a pharmacy. And then those who had higher income, so those above the national median of income, were 3.5 times more likely to have received a non-influenza vaccine compared to those below the national median. And so this really just, again, speaks to what we know is our existing market for pharmacy vaccines. Women nationally, and not just in pharmacies, but just national immunization rates are generally higher in women. Our older adults, they have more vaccines that they need. A lot of our vaccines that we offer are marketed towards the older age group anyways, and we see that nationally more well-educated and higher income people are more likely to be vaccinated. So I won't spend too much more time on that. The marketing implications there, do we want to focus on really targeting those people we already know are more likely to get pharmacy vaccines? So should we really focus messaging on women, on our older adults? Or should we try to expand our market more and try to capture more of those men, more of those younger adults? That's an interesting question, to see which types of those marketing strategy would better increase how many people we're able to get at the pharmacy for vaccines. So again, opportunity for future research. All right, and here's one where I want to pause for a moment because caregiving, we know that caregiving is a substantial burden. And we know that caregiving is very much on the rise with the rise of the boomers. We're going to have more and more people in that 30 to 40 to 50-year age group who are going to be sandwiched between caregiving for children and caregiving for older parents. And that's going to create, and already is creating, really a substantial burden. And so I think that this is a place where pharmacists can really step in and provide help and assistance to those caregivers to make their lives easier. And we found that caregivers were over twice as likely as non-caregivers to use medication synchronization and adherence packaging services, which again, those were the services that were associated with knowing your pharmacist. Caregivers were more likely to know their pharmacists. And so this is not an area where I hear as much conversation about really targeting pharmacy services too, but I think it would be a really meaningful way for us to make a difference to a lot of people and maybe currently an underserved market for our services. So again, caregiving is on the rise and prevents an opportunity for marketing our services. So adding a take-home point there too, that these expanded services, again, opportunity to lessen caregiver market and consider marketing them accordingly. So I'm glad I wanted to finish up with some time because I know this, as I said, hypothesis generating. So I'm just curious to hear what your all thoughts are on this, what you think out of this kind of piqued your interest as how we can either market our services better or delve into research a little bit more, one of these findings that you think should be explored a little bit more. And we only have one microphone, so I don't know if somebody wants to start us off and then I'll pass. Everybody says, well, I already knew most of these findings anyways.
One was, I'm wondering with these 44 and under or over 44 differences in independent pharmacy usage, I wonder how that may change over time as people age. Like, because this is just a snapshot in time,
Right.
What does that really mean? And if you increase more younger engagement, would that be sustainable over the long term? Like, I just think it would be interesting
Right.
for sort of a longitudinal type work.
Right. I agree. Well, and some of that speaks to basically are the millennial preferences. So is my preference for local shopping just a result of my age, or is it a result of my whole kind of generation that as we continue to age will still be generational preferences?
Right,
to some extent,
exactly.
is what you're, yeah.
I mean, not just your age, but your stage in life, like young kids, and your life is different.
Right. That would be, that's a really good research question in terms of how, like, almost if you can get like a trajectory of where people go over the years. So like when you have a kid, then all of a sudden do you want to go to the chain pharmacy because they have the drive-through and your kid's screening in the back?
And they have more convenient hours.
Right.
You know, because your child gets an ear infection at a time where the independent pharmacy is not open.
Right.
Like, where are you going to go? You're going to go to a big chain.
Right.
So I just that was just sort of something that jumped out at me.
And then what can, I would add to that too, because a lot of independent pharmacies actually do offer off hours for regular customers. So like if you are like a regular customer who needs something filled like late at night, particularly in these rural communities, they will come in and fill it for you. So is that something that they should be marketing more to avoid losing those people?
That pretty heavily, because that's for me, that's the same thing as we have all of these meat-laden things on a menu at a restaurant, but you can specifically ask for them to keep the meat out or substitute. But if it doesn't tell me that on the menu, right. I'm like, there's nothing for me to eat here.
Yeah.
You know, like some kind of information ahead of time would be helpful.
Yeah.
Because if I were a mother of young children, I would probably choose something that I felt was going to be generally more accessible.
Yeah.
If I didn't already know that this pharmacy that closes at noon in rural North
Yeah.
was going to make exceptions for me. And plus, then I think I would feel 50. But anyway, that's.
Yeah. No, that's a really good point. I will add one thing is that the age group was 18 to 44, which is really mostly 24 to 44. So I could run to see what percentage of them like reported having kids or caregiving. My thought is that a fair amount of them probably do have kids, since it's skewed towards the 30-year-olds and 40-year-olds. But yeah, those are really good
I mean,
thoughts.
some of your 44 to young 50s could also have very young children.
Yeah.
Because people have children that live or anything.
Yeah. Very good. Thank you. It's a tough bar, but anyone want to follow up? Oscar.
I have a question. First of all, thank you for this really marketing course. So I have a couple of questions about what you just talked about. And the first one has to do with the fact that is there an opportunity for independent pharmacies in that, specifically in the rural areas? I was trying to see if I can search if I can find it, but what is the size, or how much of the market is concentrated in rural communities? To understand if there's an opportunity for independent pharmacies or actually mass merchandisers. Because if, say, 25% of the market is concentrated in rural areas, then when you're saying mass merchandisers is that, hey, you guys can get a quarter of the entire business if you do something about it, right?
Yeah.
And the other question that I have is, has to do with what is driving the relationship between the patient and the pharmacist. We know that opportunity for the service itself might be the initiator of that relationship, but what drives the continuation and the deepening of that relationship? And here, as from a research perspective, the psychometric model of investigating those emotional dimensions and how they build that relationship over time, that might influence the existence or non-existence of that trajectory over time. Maybe.
Yeah, well, to the latter, I think that sounds like a perfect dissertation topic, right? Because we don't know, and so I think this is very kind of foundational research on a lot of fronts, because just nobody has tried to look nationwide to just ask these questions to even see what the patterns might be. And now that we see that kind of nationwide, we're seeing consistently that these relationships are being built, I think that provides more justification, even more justification for what you're saying in your latter comment about, well, let's understand, was it that the patient signed up for the program because they already wanted that relationship, and that the pharmacist then didn't have to really put in that much effort to really like engage the patient? Or was it because the pharmacist was really passionate about the service and drew people in who then built a relationship? And my research certainly cannot answer that at this time. But I think understanding that would go a long way in, are we cherry picking the patients, or is there something that we can train our pharmacists to be more engaged, or give them more opportunities, more time to not just be dispensing all the time, just to have the space and the encouragement to engage with those patients? I think it's
91% of people preferring to go to a brick and mortar store for this particular area is a staggering number. Because most people in other services, online shopping is becoming a preferred shopping experience. But if you have 91% of the women still saying, hey, I am well aware of an online shopping experience as an alternative, but I still prefer to go to the
right.
It's got to be more people.
Yeah. Yeah.
So some of these.
So the mic is up.
I don't care.
I thought there was somebody that was new then. Is that not true?
Is anybody in Inova
You would have to say they could have
asking a question? I can see them now.
So let's assume they're not there.
There we go. We can look at that.
Nice try.
So this is Dr. Holford talking, in case you can't see. So it seems like a lot of these things are driven by two different factors. One is patient choices, and the other is insurance policies. And I have some serious issues with forcing people to use mail order, just forcing people to use mail order. It might not be the right thing, especially for seniors. And seniors are probably the least I think they're the ones that probably should least likely be using mail order. You were describing medication synchronization and packaging. For caregivers, my wife is a caregiver. That's what we use. We use those, and they're extremely valuable. And there's people that aren't getting any of this because they're being forced, and they're also being somewhat lied to. Is you get the exact same thing, but you pay less. But really, what you're doing is you're having to pay more. You're being punished for having free choice. So there's different ways of looking at it. So it seems to me, I don't know what the literature is on this, but I would make a hypothesis that people who use mail order are more likely to truly be non-adherent with their medicines. I say truly because when you use the measurements we have is how often you get your prescriptions filled. Mail orders send your medicines to you. That means, according to their measures, you are actually filling the prescription. They mail it to you, so they're ensuring that you're adherent according to the measures. But if you go and spend some time with these patients, they're probably not taking their medicines.
Yeah, that's a really good point. Because all the studies with administrative claims data do show mail order has really good adherence, but like you said, they're getting them every month, and that's what administrative claims data captures. And I would just go back to, then that ties in with Vasco's first question about the market share of independent pharmacies in rural communities. And I know that most independent pharmacies are in rural. I don't know within the rural community what it currently is, but I know that it's changing because a lot of independent pharmacies, rural pharmacies are closing, and so that's driving people already to the Walmarts and things like that. So one of the research questions I had posed in the study was, what is the impact of those rural pharmacy closures on long-term medication adherence? So if you can no longer go to the pharmacy where you know the pharmacist, and you can go to church with the pharmacist on Sunday, and now you have to drive 5 miles and just go to the big box Walmart, is that not that I'm like hating on Walmart at all, I don't want to come across as that, but is that having an impact on patients' ability to manage their own health, as I think is a good.
If you could design a study to answer like questions that are burning, what would you do? What kind of study would you do? Let's say you had a very large budget that was supported by NACDS and NCPA at the same time.
I mean, there would be like a different study for so many different questions, because I feel like you could do a really interesting qualitative study on what really forms and promotes that relationship to understand both the patient processes and pharmacist processes involved in that. But then you could do a big claim study to look at if these pharmacies closed, where did they go, and then what their adherence was. I think you could use claims data to answer that question. So I think there's a lot of research questions, just have to decide which ones are most, I guess, fundable and interesting and important to ask. So, all right, I went a little bit over, but unless there's any other questions, you're welcome to come up and talk with me afterwards. So thank you all for coming, and have a good afternoon.